Hi, my name is Rick Olderman. I'm a physical therapist and anesthesiologist practitioner, and I'm going to talk to you about headaches, neck pain, shoulder pain, elbow pain. Why do we have these things? Why are they chronic? How can we fix it? It's important to understand that our bodies work as a series of systems, so injuries rarely occur in isolation. Neck and upper extremity injuries can include things like shoulder bursitis, headaches, neck pain, tennis elbow, carpal tunnel syndrome. Basically anything influencing the upper body is what's included in this video. So the shoulder girdle system is basically a floating system. It's unlike any other system in the body, so we have to look at it a little bit differently. Here's what I mean by this. If you look at the rest of the body, you'll see that one bone rests on top of another. Another bone rests on top of another. And this is how it goes all the way up the chain. But the shoulder blades are a little bit different. They kind of float on the rib cage. They're not resting on top of the rib cage per se. They're influenced by the rib cage, but they kind of float. In fact, their only attachment, true attachment to the body is via this horizontal collarbone here. So we have to look at this a little bit differently than we do the rest of the body. The role of the shoulder girdle is to support the arms when they move. And there are rules about how this should happen. One is that when the arms are resting down by their sides, that the outer part of the shoulder blade should be resting at thoracic level too. And then this border of the shoulder blade here should be resting 3 inches from the spine. And frankly, that's regardless of whether you're 5 feet tall or 7 feet tall, 3 inches is basically where things should be. And so if it's resting too close or too far away, well, that tells us a lot about what's going on with this the muscles that are controlling the shoulder blade here, as well as if the shoulder blade is resting too low. Now, as I mentioned before, the whole role of the shoulder blade is to support the arm when it's raising up overhead. And so the rules about this are that it should be rotating about 60 degrees. And this outer part of the shoulder blade should be coming up to the last cervical or neck bone vertebrae right here. And then this little corner called the inferior angle should be coming out to about the midpoint of the trunk here, right about where the seam is of your shirt on your trunk here. Sometimes there are structural reasons the shoulder girdles won't rest or move well. And what I mean by this is, the shape of your spine has a lot to do with how these shoulder blades move. Now, another thing that's going on here is something called a side bending problem. And you can see here that this woman's crease in her back is larger on this side and more prevalent than this crease on this side. And that's because this side of her rib cage is actually dropping down. In fact, this side of her hip is actually elevated too. You can see if you look at her pants closely, this side is a little bit higher than this side over here. So she has what I call a side bending problem. This one's on the left. And the rib cage is being drawn down on this side, which then means, because the shoulder blade roughly rests on the rib cage, that the shoulder blade is sitting too low too. Here's what's going on from a muscular standpoint. These are some of the muscles that are very tight and contracting and pulling the rib cage down, and therefore pulling the shoulder blade down too low. And you'll see why this is important in just a second. Here are some reasons why this might be happening. If we have lower body issues, well, they can influence how our legs are resting and how we're walking, which then can create this side bending problem. And there are other issues that we have, pain in our upper body and chronic neck pain. For instance, if we have a cardiac or heart problem, that can refer to the jaw or the left shoulder or arm. So it's important to understand, if you have a heart condition, this may be influencing why you're having left shoulder and neck pain. We could have tears or bone spurs in our shoulders. And the reason I'm mentioning this is that, especially for those of you with neck pain or headaches, is that most doctors will have examined and taken MRIs of your neck or x-rays of your neck, but they haven't really looked closely at your shoulder because they don't understand that the shoulder is influencing the neck. And so you may have a tear or a bone spur or something like that going on in your shoulder that's causing the shoulder system not to work well, which then stresses your neck. And again, I'll show you how that works in just a little bit here. Chronic use of antibiotics can create tendonitis issues. In the liver, if there are liver issues, you can have peripheral nerve problems that can actually create carpal tunnel syndrome in both of your hands. So if you're having carpal tunnel syndrome or perhaps thoracic outlet syndrome or something like that in both hands, you may want to consider that you have an intestinal issue, and you may want to get that checked out, especially with the liver. And the gallbladder can refer pain to the shoulder as well. The diaphragm can refer pain to the neck and shoulder. So if you think that you have some potentially unrelated issues with your viscera, and they may not have anything to do with your neck pain and headaches, or shoulder pain, or elbow pain for that matter, think again. And let's start putting these dots together. Go to your doctor and have all of these systems checked out, and ask your doctor whether they feel that this could be referring pain to the side of your pain. It would be nice if it was more of a simple intestinal issue or visceral issue, and they could solve that, which would then solve the musculoskeletal issue. Okay, well, how do the shoulder blades then affect the neck or the headaches? We've been talking a lot about the landmarks of the shoulders and so forth, so let's figure this out. Here's what's going on. Here's a shoulder blade, and there are several muscular attachments to the shoulder blade. One of them is the trapezius muscle here, this big guy that goes all the way down the spine. It inserts into the shoulder blade like this. It goes up to the base of the skull too. And this, as you can see, I always describe this kind of like a hand muscle. It's a big, powerful thing that's made to do a lot of jobs. And so it needs to be working really well in order to control this whole very important system. So when the trapezius doesn't work well, you can see deep to it is this muscle called the levator scapula. And here it is over here. We've taken the trapezius off. And the levator scapula starts at the shoulder blade here in the corner, and it inserts into C1 through 4. I've seen it in C5 too, and sometimes even C6. So it has a lot of insertions into this, but look at the size difference of these two muscles. Here's this massive hand muscle, the trapezius, but here's this little pinky muscle, the levator scapula. And so what's going on with chronic neck pain and headaches, or people who experience a lot of burning along this side or pain, is that usually the trapezius isn't working well. And so the levator scapula has to work harder. And so because it's being overworked, creates this burning and painful issue. It can cause compression of the vertebrae here, side bending, rotation of the vertebrae, compression at the cervical area where the skull is meeting the neck here. It can cause all sorts of problems when this trapezius muscle isn't working well. And so this is a really important thing that you'll be testing in the program here, to test your trapezius to see if it's working well. And in most people with chronic shoulder pain, chronic elbow pain, chronic neck pain, or headaches, you'll find that the trapezius is not working well. And once we fix this, lo and behold, pain starts to melt away. All right, so what are the muscles that cause scapular depression? So I mentioned earlier that when the shoulder blades are sitting too low, that's the most common problem I see. I call that scapular depression. So what are the muscles that are causing that? Well, we have a latissimus dorsi muscle, which starts down here at the pelvis, and it goes all the way up. It clips the corner of the shoulder blade here and inserts into the arm bone. So the latissimus dorsi affects back pain as well as shoulder and neck pain, and that's a nice connector between the two zones here. Now, the lower fibers of the trapezius, you saw that they come way down low on the back, and so if those can also create shoulder blade dysfunction, which then creates neck pain and shoulder blade issues and even elbow issues. Now you can see underneath the shoulder blade there's this little muscle. We're going to be looking at this a little bit more closely, called the serratus anterior, and many of those fibers can pull the shoulder blades down as well. That's all the stuff that's in the back. Now in the front we have a lot of the chest muscle fibers can be pulling the shoulder blade down. We have this subclavius muscle which can pull the collarbone down, which then pulls the shoulder blade down. We have a pectoralis minor here, and that is deep to this pectoralis major, that can pull it down. And then here's our good old serratus anterior, which we'll look at a little bit closely in just a little bit here. So those are some of the main muscles that are pulling the shoulder system down and therefore stressing the neck and the shoulder areas. Now, here's the serratus anterior I was mentioning before. It turns out this is a really, really important muscle group. You can see this picture is showing that it starts here on the border of the shoulder blade underneath the shoulder blade. So it starts on this medial border closest to the spine. It comes across and it inserts into all of these ribs. And when this is dysfunctional, typically what happens with chronic neck pain and shoulder pain, I find tons of trigger points and knots in these muscles. And this muscle is very tense. And so working this out starts to free up the shoulder blade, which then starts to take stress off the neck by virtue of those attachments I showed you earlier. And it also helps the shoulder joint move better too, because now the shoulder blade, which is supposed to be supporting the shoulder movements, can move. So this is a really important muscle group, and I have a couple techniques that I show in the interactive online clinic how to work with these trigger points, both from yourself, and also I show practitioners how to help you with this as well. Okay. Now another thing, bras can contribute to chronic shoulder and neck pain. And so I want you to think about this as if I were to hold a weight in my hand, let's say a 5 or 8 pound weight here, and I was to hold this out in my hand all day long, my shoulder would get really tired. But if I put that same weight on my shoulder instead, well, that would be a lot easier for me. And this is all about lever arms, okay? So I want you to think about that in terms of this woman here. When you have a bra strap that's sitting way out here on the shoulder blade, especially if you have wide shoulders, that's like putting that 5 pound weight far away from your body, and it's constantly pulling the shoulder blade down. Well, now you understand why the shoulder blade is so important with chronic neck pain, shoulder pain, and elbow issues. And so if we can move the bra strap closer in so it's not resting so much on the shoulder blade itself, well, that can start to solve a lot of stress that's being delivered to the neck and shoulder. And so I just have a little simple taping technique that can do that. You just tape them together. Now there are bra clips that do this too, and there are bras that are made to be clipped together like this too. If you have those kind of bras, start clipping them together to take a load off the shoulder blade and therefore your neck and shoulder. All right, but what about the painful trigger points in my neck? This is a common question I see in my clinic all the time. People have these really painful knots in the back of their neck here at the base of their skull, and they'll go to a massage therapist or a physical therapist or someone, and they will work on these painful knots, and they will feel wonderful once they're worked on, but they keep coming back again and again. Well, it's important to understand that the knots are happening below the trapezius again, and they're roughly in the same area of the levator scapula insertion too. So when the trapezius isn't working well, it's stressing these muscles deep to it, just like it's stressing this levator scapula. And so those knots will come back again and again until you fix the root of the issue. And again, that's what this clinic is all about, is getting to the roots of your issues and fixing those. Well, what about other things causing shoulder, arm, or wrist pain? Well, let's take a look at those really quickly here. There's something called anterior hemoglide syndrome, and basically what it means is that the head of the humerus or the arm bone is, and this person is facing forward here, the head of the arm bone is too far forward in the shoulder socket, and that stresses the tissues of the shoulder joint, and that can cause a lot of chronic shoulder, neck, and even elbow pain too. Here's a picture of a girl. Her left shoulder looking good. That head of the arm bone is right here, right about where it should be. This is the upper shoulder bone, the acromion, and you can see that the arm bone is equidistant pretty much on both sides of that acromion there. But on her painful side, here's the acromion here, and here's the head of the arm bone. It's way forward, and that's what's called an anterior hemoglide syndrome. And you can see, if you look at this arm, you can see how this arm is resting straight down, but she likes to hold this arm back a little bit more, and that's one of the habits that you'll be fixing to solve this problem. There are also a problem, especially with elbow and wrist issues. Tight forearm rotator muscles are often an issue, especially in our society where we do a lot of typing. These deep rotator muscles become very tight, and they cause chronic tennis elbow and chronic golfer's elbow. And you can see these are the pronator teres and the supinator muscles. Now, look at where they're inserting. They're inserting just about right where we have chronic tennis elbow pain and chronic golfer's elbow pain. So I have found that if I can stretch these out, it is almost a miracle for a lot of my chronic elbow and wrist people, because look, here's one of them down here too that also can contribute to wrist pain. Quite frankly, I rarely fix these in isolation. I usually have to fix something up in the shoulder blade too. And so that's why it's important to always look at your body as a system, that the shoulder blade may be influencing the activation of these pronators and supinators. Okay, so that's what I'm talking about with the deep forearm rotators that may be contributing to elbow and even wrist pain. Hypermobility. Well, I've got a little video I've made about hypermobility and how that contributes to pain, but that is a big deal in terms of creating chronic stress to the upper body. People who are hypermobile tend to love to do things like yoga, Pilates, dance, gymnastics, swimming. All of these activities reward joints that are excessively lengthened. And the reason those joints are excessively lengthened is because the ligaments are too long and they're unstable. And so for these people, I have specific recommendations that you'll see in that video, and that's in the fine-tuning section, which is lesson 2 of this interactive online clinic. So check those out if you think that you're a hypermobile person or you tend to gravitate towards these issues and you have chronic pain. Posture is a big deal too. So posture, by that I mean if you have poor posture, typically the shoulder blade will rotate forward, and what that does is it starts to close off this very important rotator cuff muscle here and causes it to pinch prematurely. It's called an impingement problem, but this is how these things get broken down and eventually a tear can come. So a postural issue is pretty important, and I have a recommendation I call lifting the rib cage, and you'll see that in lesson 6 of the program, how to do that, and it's very effective for unloading chronic stress due to posture to the shoulder. So fascia is another system that plays in injuries, and fascia is simply just connective tissue. It's connecting one tissue to another. It joins muscles together, connects muscles to bones, it supports the blood vessels, the nerves, everything. It connects everything in the body, and so it's a really important tissue, and it has the ability to contract. So here's a picture of a fascial highway in the upper body system. All right, so if you look at this hand here, you can see that it is fascially connected all the way up into the neck. And so when I work with the neck and shoulder pain, I often am working also with the hand and the elbow. And vice versa, if I have hand or elbow pain, I'm also working with the neck and shoulder, because this is one contiguous system, and it's important to consider all of this. So in the lessons I offer trigger point advice for working on the whole system, and if you have tried dry needling, which is using acupuncture needles, I show the points that I like to use along this whole system to alleviate neck, shoulder, elbow, hand, wrist pain, and so forth. It's important to think of this as one system that works together. Now you'll see this TGF-beta 1. This is a chemical that is released by the immune system, transforming growth factor beta 1, and it causes fascia to contract. So the thing that's causing the immune system to release that is the sympathetic nervous system. And I talk a little bit more about this in another video, stress and chronic pain. But here's a woman here. She believes that she is relaxed right now. And you can see this is definitely not relaxed. These muscles are actively contracting. Here she is lying down on a pillow. We've propped her as best as we can to try to get her to shut off of these muscles. So her nervous system is constantly turning on these muscles, which is activating the fascial system as well, and causing chronic stress and pain in her neck and shoulder area. So understanding how to get at this is going to be really important to solving her pain. And there are several techniques that I have in this interactive online clinic that will address this type of stress and chronic tension. All right, so if you have chronic neck or upper body pain or headaches, it's likely you haven't been fixing or addressing a lot of the issues I've been talking about in this video here. And if some of this stuff is new, or if all of it's new, well, hey, you're in the right place, because this is where we address all of this, and I'll teach you how to fix a lot of these issues that are feeding all of this stress to your system. So what to do next? Well, you have a couple options. So the first step is to understand what's wrong, and that's what's going to go on in lesson 2 and 3. In lesson 3, we're actually going to be doing a lot of testing to find out what tissues are not working well. They may be tight or weak or what have you. And from this testing, you will be given an individualized plan to start fixing your problems. And then you'll fix it. And that's what's happening in lessons 4, 5, and 6. And you'll pick the stretching exercises based on the individual plan, which is generated from your testing. So you'll know exactly what to focus on. And then there's more fixing. In lesson 7, we have strengthening. In lesson 8, we have somatics, which is teaching you how to release tension in your body systematically. It's a very powerful lesson. In lesson 9, I have some odds and ends that don't quite fit in any other lesson, and so I just throw them in here for you to check out and see if they help you. In lesson 10, let's face it, sometimes you just need hands-on help. And so in lesson 10, I've made videos of the most effective techniques that I use for my clients. And so these are intended for you to bring to your medical professional so that they can help you. And then final fixing is happening in lesson 11 with advanced somatics, and lesson 12, advanced strengthening. And so here's where you top off your program and you start to feel hopefully a little bit more confident and a lot less pain. And you start incorporating this into an exercise plan or sports or whatever it is that you want to get back to in your life. So I want to thank you for watching this video, and I hope it's given you a better understanding of what you're going to be doing in this program and why you're having pain. And my hope is that a lot of this information is new to you, and no one's really looked at your body like this before. And so if that's the case, then you're in the right place, because we're going to fix every system that we see wrong in your body. And I'll show you how. You'll have videos for all of this to follow. You'll have an individualized plan, and I really think it will help you significantly. So I wish you the best of luck. Thank you.